significant number of COVID-19 patients, higher than the first peak back in April, but they say that patient safety is always the top priority for their staff.
So how serious is the situation in Scotland's hospitals? Dr. John Thomson is the Vice President of the Royal College of Emergency Medicine in Scotland. Morning, John.
Good morning.
Firstly then, we're mainly talking about the areas covered by the Greater Glasgow and Clyde Health Board in terms of today, and the Lanarkshire Health Board as well. Can you give us a feel for how stretched things are in terms of hospital beds and critical care beds as well?
Yes, there's no doubt that there's significant pressures on the health service at the moment. In the areas that you've mentioned, really since the beginning of October, there's been little let up in new cases daily of COVID. And whilst it may have plateaued recently, it's certainly not decreasing, and that's placing a significant impact on the hospitals, both critical care beds but also non-critical care beds as well, which is having further impacts downstream on patients waiting in emergency departments for a hospital bed, sometimes significant periods of time and overnight in some instances as well.
Now, how many hospitals are actually full at the moment?
It depends on your definition of full. The main area of concern is around capacity for medical beds, where patients are being admitted to with COVID. So it's clear that the majority of hospitals are full, if not almost full, on a daily basis, and are struggling to cope with the new intake each day.
We're coming into winter, of course, where the NHS seems to be under the greatest strain, even when there is no pandemic.
Yes, that's absolutely correct. That's traditionally a very challenging time for the health service, and it will be no different this year. And I think that's why it's really important that we try and do something to reduce the incidence or the new cases of COVID, and try and protect the health service by reducing the number of patients that require hospital admission.
If things are so tight in terms of available beds, then why not make greater use of, for example, the NHS Louisa Jordan Temporary Hospital?
That's very difficult because staff require to go with the patients, and staffing our current normal areas is also very challenging at the moment. One of the things we've seen with this second wave is the increase in the cases of in-hospital infection, both of patients and staff, and a number of wards have had to close and staff self-isolate. So as well as struggling from a capacity perspective at the moment, it's very challenging on staff in order to staff the areas we have currently.
So why have the Louisa Jordan there at all then, if staffing is a problem?
I guess it's there as a part of the contingency for the pandemic worsening. So it's there as part of the government's
It's pretty bad
plan.
at the moment.
Yes, it is, and I guess you would probably have to ask someone in government why we're not using that at the moment. But it's not as simple as just opening that. As I said previously, particularly if you were to put inpatient type patients there, then you have to have the adequate resources in terms of equipment and staff to look after them safely.
Now, this has put a lot of pressure on the staff work in the NHS just now. What is morale like at the moment?
You've got a pretty robust group of staff that work there, but there's no doubt that it's taking its toll. For example, in my area of emergency medicine, it can be quite demoralising for the staff when we're unable to move patients into the hospital, into a bed, and we're having to look after patients on trolleys for a number of hours, sometimes well in excess of 12 hours. So it's a very poor experience for the patient, and it's certainly demoralising for the staff.
How can you get admission numbers down then?
I think you've highlighted the fact that some of the areas you've spoken about are likely to head into Tier 4 and more severe level of restriction, and that really comes down to trying to reduce physical contact. That's the one way that we know that this virus can spread very quickly from person to person. So we need to try and reduce the incidence of coronavirus which will then ultimately reduce the need for people to be admitted to hospital.
I mean, do you also think that people with certain conditions, not coronavirus related, are better off staying at home and not coming into hospital?
I think one of the worries in the first wave was that the number of presentations to emergency departments decreased, and the worry was that people were actually waiting at home and not coming to hospital with quite serious medical conditions. And I think it's important that people understand that the emergency departments are there for people who need us most, and that is the sickest of the sick. So if you have a health problem, it's important that you contact your general practitioner or you come to hospital.
Do you think it's likely to get worse in the next few months, or does that depend on the current vaccine issue as well?
I don't think we'll have a vaccine that will impact on the next few months, as you say. I think it's going to be the new year before we see potentially any impact of that. And although there's been quite a lot in the media recently about vaccines, we've not really seen the full scientific data yet to know just how effective it's going to be. So I think certainly the next few months are going to be incredibly challenging, and I think it's important that people follow the guidance and continue to wear their face masks, socially distance and wash their hands regularly to try and prevent the infection.
OK, thanks for now, John. That's Dr. John Thomson there, Vice President of the Royal College of Emergency Medicine in Scotland.
7:15 if you're keeping